Thank you everyone for joining us this evening. I'm just going to say a few words and then I'm going to pass the evening over to our guest presenters. So first of all, welcome. And for those of you who are more recently, Mazal Tov on your Aliyah. For those of you who have been here a little bit longer, big hello. My name is Sippy Oppenheimer. I'm joined tonight by my coworker Aviva. We are part of the NBN Post Aliyah and Advocacy Department, also known as the Answers Team. I put in the chat how you can reach us. It's important for you to know how to reach us. We have an email address, answers@nbn.org.il, or you can call us star 3680 Sunday through Thursday, 9 a.m. to 5 p.m. Before I introduce the guest speakers and before we actually begin, I do want to just say a couple of things. Some of you might know us and the Post Alley Department and things that we do. Some of you may be less familiar. We do have these open forums once a month, each time almost always focusing on a different topic. We also, for those of you in your first year of Aliyah, you should be getting emails monthly from us and phone calls. And if you do not, please contact us at Answers if you've changed your phone number, if you changed your email. Um, Always please let us know. That's very, very helpful. Um, Today's session is going to be recorded. It is being recorded, and you will receive an email follow up with a link to the recording. That may take a couple of days while our marketing department processes it and puts it on our YouTube channel where you can also find it there. For those of you who are willing to, show yourselves on camera, that's wonderful because it's always nice to be able to speak to people. But I understand, we certainly understand if it's not convenient for some of you. This evening you're going to stay muted. We're going to keep everybody muted except our speakers, um, who I'm going to introduce, I promise. Uh, if you have questions, what I suggest is holding off on the questions. If you need to write them down in a sheet of paper by your computer, but hold off on the questions so that you can be focused on what is being presented, what is being said, not just because your question might be answered, but of course because we want you to be able to be focused and in the moment. I would also say that at the end of this presentation, there will be at least 10 minutes for questions. I'm not promising we're going to get to all your questions. I hope we will. And when you do type in questions, they should be specific, excuse me, they should be general that will be relevant to everybody, clarification type questions. If you have personal questions you want to ask, you should be in touch with us tomorrow. Answers@nbn.org.il. Call us at star 3680. If it's something we can help you with, we will. If it's something that we need to refer you elsewhere, we will do that as well. So thank you very much for joining us this evening. We're hosting two wonderful guest speakers, Yair Berko and Dr. Nechama, whose last name just got Nechama Monk, sorry, who is going to be more in the background. Um, we're doing the session navigating the mental health care system in Israel with the knowledge that this is an important topic for Olim. Making Aliyah is always a wonderful, amazing, tremendous experience, but we also know that Aliyah and immigration to a new country is a huge transition. And with it sometimes comes the need for mental health care and welfare. And the mental health care system in Israel is different than what you know it from North America. So I first would like to introduce, so you know who's joining us this evening, Dr. Nechama Monk. She is the director of the Wurzweil School of Social Work of Yeshiva University in Israel. In collaboration with Amudim, Nechama co-founded the Jerusalem Therapy Center, which is where Yair is from, which is an English-speaking mental health clinic in Jerusalem. Dr. Monk also worked as a licensed social worker for 10 years at the Rape Crisis Center for Religious Women in Jerusalem and managed a domestic violence treatment center for WITSO for 7 years. In addition, Nechama has a private practice for over 20 years, specializing in treating trauma, sexual trauma, and abuse. So thank you very, very much for joining us. We really appreciate it. Starting the presentation will be Yair Berko, who is the clinical director of the Jerusalem Therapy Center. For those of you who aren't familiar with it, that is, as I said, a collaborative initiative between Amudim and Yeshiva University Wurzweil School of Social Work. It is located in Jerusalem and serves the larger Jerusalem community, especially or tailored for English speakers. Yair has many years of experience in both clinical practice and administrative leadership of mental health organizations. He is a cognitive behavioral therapist specialist, a senior supervisor, and lecturer at the Israeli Association of Cognitive Behavioral Therapy. In addition to his public health roles, Yair maintains a private practice in Jerusalem. All that is being said, so we can first of all really appreciate your time. Thank you. Before we begin, thanking both of you so much for volunteering your time and your knowledge and your experience. As I said, this is being recorded so that it will be available to Olim in the coming months, this very important information. So with that being said, I'm now going to stop talking and I'm going to give the microphone over to you, Yair.
Thank you so much, Sippy. It's a pleasure to be here tonight, together with my colleague, Dr. Nechama Monk. I'd like to thank the Nefesh B'Nefesh team for organizing this event and for making it happen. So thank you so much, and it's a pleasure to be here. I'm going to do share screen now and upload a PowerPoint slideshow. Just let me know if you can see it. Sippy, can everyone see it?
I see it. Yeah.
You do? Okay.
Yeah, but you have to change it to slideshow mode.
Hold on. Okay.
Right. We can see all the up and coming.
Okay. Perfect. Better? Okay. Wonderful.
Thank you.
Okay. So our topic tonight is navigating the Israeli mental health system, which, as Tippy mentioned earlier, it's quite different than what we're familiar with from North America. There'll be a lot of information. I'll try to fit in as much as I can, and we'll be happy to provide answers for any specific questions at the end. And this slideshow will also be available on the Nefesh B'Nefesh, different platforms of media. Okay. So the topics we're going to cover tonight are how to navigate the Israeli mental health system. We're going to discuss different resources that are available and how to actually access the help in time of need. So briefly about the system, the mental health system is under the auspices of the Ministry of Health, Misrad HaBriut. They oversee all the services, including the services provided by Kupot Cholim. Okay, and the Kupot Cholim are in essence service providers for Misrad HaBriut. Okay, we know there's four big Kupot in Israel: Talit, Maccabi, Meuchedet, and Leumit. So a lot of the mental health services we're going to talk about today are provided through these Kupot, but there are additional organizations and agencies that are also providing services. As far as brief history, as far as the development of the system, up to 2015, mental health was not provided through the Kupot. It was provided directly from Misrad HaBriut. And there was kind of this division between physical health and mental health. And then there was a realization that that was causing increased stigma, and it was a barrier for people to get help. And they were combined, the mental health and physical health are under the same umbrella today, under the Kupot Cholim. Okay, so there was a reform in 2015 where all these services were put under the umbrella of the Kupot Cholim. In addition, more the rehabilitative services, which we'll talk about a little later on, were also, that was actually started earlier on around the year 2000, when there was a big push to provide mental health rehabilitative services in the community. Okay, so many of the services were moved from hospitals, from clinics that were situated outside of the main cities to within the community to be able to provide these services for everyone in a less stigmatized way. Okay, so I'm going to start with the community-based services that many of us may want to access or know about for our family members. And then I'll get, as we move on, to the more specific services that are there for specific populations and for people who have more intensive mental health needs. So we'll start with talking about accessing mental health services at the Kupat Cholim. So every citizen is entitled through the Kupat Cholim to receive therapy. Okay, the service, if someone is interested in receiving therapy at the Kupat, this is often given either by a psychologist or a clinical social worker, and there is a very small quarterly copay. This is if you're doing it, receiving the therapy through the Kupat Cholim. Okay, the actual process of doing this is you reach out to the Kupa, Often this is done through the family doctor, but you can also do it directly through the Kupa's app or through you calling them up. You ask to set up a meeting to see a therapist, and they will guide you as far as the process. Okay, the most direct way and probably the most straightforward way is to speak to your family doctor, your Rofeh Mishpacha, and ask for a referral to see a mental health specialist. The Kupa will then conduct an intake, and then will tell you which services you're eligible for. Okay, and we'll discuss the different services shortly. There are some small differences, as you can see, between the kupot regarding the exact process. Okay, some of the kupot you do need to go through the family doctor. That's usually Klalita and Lumit, while Maccabi Mucheret, you can just on your own reach out and set up a meeting with a mental health specialist, a psychologist, social worker, etc. I think I went the wrong way. Okay. Now, wait time, unfortunately, can take a while at the kupot. Okay. It really varies based on location. So if you're living in one of the bigger cities or anywhere in the greater Merkaz, Yerushalayim area, it will be easier to find treatment. Well, if you're living somewhere more in a smaller city or further up north or south, there'll be a longer wait and there are less services available. I imagine, though, that it's similar to all other health services. This can take up to half a year or even a year at times to be put on a wait list for therapy, which is obviously not ideal at all, particularly when people are in need. But it is important to know that if you're going directly for therapy at the Kupa, there will be a wait. Okay, it's free of charge, but you'll be put on a wait list. Once you actually have your intake, the therapist will call you in, will do an intake, and will assess your needs, and then will decide what sort of services to provide, how many sessions. Usually they'll approve a whole bunch of sessions that could be renewed as needed. Okay, so once you're actually in the system receiving therapy, it can usually go on for an extended period of time as long as you need. Okay, the Kupot also have service providers that work for them. Okay, that they are contracted with. So that could include organizations like Bayit Cham, La Merchav, or Amcha, and a few other big organizations that provide therapy for the Kupot Cholim. Each Kupa has agreements with different organizations, so you would have to find out at your Kupa, okay, which organization you're eligible to receive therapy through. Okay, I'm going to continue. The second option is going on the semi-private route. Okay, the semi-private route is each Kupa has independent contracted therapists that they work with. Okay, so these aren't organizations, rather individuals. And depending on the type of insurance you have, there's usually the basic Kupa package, and then each Kupa has a different name, Mucheretzi, Mushlam, Adif. It's hard to keep track of all the names. But if you have if you have the supplemental insurance, it will be less expensive. Okay, so with only the basic insurance, if you want to see one of these private therapists that work with the Kupa, you'll likely be paying around anywhere from 100 to 200 shekel per session. That's without the additional insurance, but if you have the higher level of insurance through the Kupa, it will be about half that price. If you want to see one of these private therapists that work with the Kupa, you contact the therapist directly. Each Kupa has a list of therapists on their website. Okay, there's usually an option to search for doctors, professionals. So within that search, you would just write psychotherapia, psychotherapy, and you would be able to find the service providers in your area. It could be based on language, location, population, etc. Okay, so you would contact the therapist directly. You would just bring your Kupat Cholim card with you, and you don't actually have to contact the Kupa for that process. Okay, so this is the semi-private route for therapy with specific therapists that work with the Kupa. And the kupot, in addition to, of course, the psychotherapy we're talking about, you can see a psychiatrist in the kupa. Here as well, there's usually a wait list, most often in 3 to 6 months to see a psychiatrist. There is a shortage of psychiatrists in the country, particularly actually for children and adolescents. In cases where there's, an emergency, they usually will see you earlier. Okay, but if it's for a regular checkup that you just need to be seen to refill medication, there will be a wait list for that as well. Okay. The kupot, they have hotlines. I've attached the numbers, the phone numbers and we'll see that towards the end of the presentation. Okay, so they have these hotlines where you could call and ask to speak to a mental health professional for guidance. The kupot do offer 3 free phone sessions to everyone. Okay, so that's for a phone call that you could contact them, and they usually provide that pretty fast. Okay, for those 3 phone sessions, which is kind of more just pretty acute needs that you would have. And lastly, there is the option of, this is not through any of the kupot, but if you'd like to go private, some people choose to go private because of they can't wait. Their health needs are more immediate, or they prefer choosing their specific therapist from even I guess a therapist who isn't in the kupa list. And private psychotherapy, usually depending where you are and on the training of the therapist, will vary. Usually between, I know it's pretty broad, but 300 to 800 shekel per session. What is important to note is that psychotherapy in Israel is not very regulated, unfortunately. So it's important that you verify when you reach out to somebody, if you're going the private route, to make sure that they're they have credentials and they're licensed. And this you could actually look up on your own when you reach out to a therapist and you have their name. All the registries are listed on the web. Okay, so you could find the psychologist. You could look up. You could put their name in the psychologist registry, the Pinkas Psychologim, and see if they're listed. Same for social workers and same for doctors, for psychiatrists. Okay, this is to avoid fraud and people misrepresenting themselves. So this is something to keep in mind because in Israel it's much less regulated than in North America. Okay, private psychotherapy. Okay, children, really is pretty similar, the process. Children are also eligible for all the above services for psychiatry, psychotherapy. They, in addition, different types of what we call tipul rikshi, emotional help, which is more the, I guess, expressive arts and the more play therapy and stuff of that nature are also offered. For younger children, the most direct way to get services is to ask your general practitioner for hafnaya to hitpatkut hayeled, okay, which for those of you who are familiar, is an umbrella clinic usually where they have services for all children with either developmental delays or specific learning disabilities. And at these clinics, they provide a holistic umbrella of all sorts of services, which include psychiatry, psychotherapy, occupational therapy, physical therapy, speech, parental guidance as well. So if we're talking about children, the best way would be to ask for a referral to Hitpatkut Hayeled. This is covered by the Kupa. There may be a very small copay, but it'll be very insignificant. And this is probably the best way to go. It is important to note that the earlier one goes to Hitpatkut Hayeled, the more they'll be eligible for. After, I think, the age 9, it's much harder to get those services. So if you have a child or a grandchild who needs extra help, it's best to reach out early on and be in the system at a younger age, as opposed to trying to get in middle school or at a later point. Okay. Hold on. Okay. In addition, I would just mention that through the municipalities, there's what we call the SAPACH, the Educational Psychology Services. Okay, this is a school psychologist. So each municipality, so Jerusalem, for example, they have a big psychological service for the schools. Each school will have usually, the psychologist that is in touch with the school. They give guidance both to parents, teachers, and they'll do specific interventions with children in the school as needed. This is not, though, ongoing therapy. Okay, so this is if, let's say, during wartime. Okay, so they'll provide different workshops and guidance for the school, for the teachers, for the parents, for the children. Or if something happened in the school, they'll get involved and help. And if there's a specific issue with a specific child, they also might offer a meeting or 2 or 3 with the parent, the family, the teacher, but this isn't ongoing therapy. But it is good to know that they're out there, and at times they will be able to offer additional services. For example, they at times will be able to do a psychodidactic evaluation for a child, which could be helpful if you need different benefits for Bagriot, etc. Okay, so that would be the educational psychology service. And that would be access. You would just ask the principal of the school or the school counselor how to get in touch with the person who, the service provider in the school of your child or grandchild. Then move on. Briefly about children on the spectrum, on the autism spectrum. Here too, the best way to go about getting services is through Hitpatchut Hayeled that we discussed earlier. The process includes an assessment done by both a psychiatrist or a neurologist and a psychologist. Okay, you need to get an evaluation by both of them. Here too, the younger you do it, if it's done at a young age, it will be covered by the Kupat Cholim. While if it went under the radar and wasn't diagnosed, the person goes at an older age, it can be quite expensive to get recognized and to get services. Okay, when one is on the spectrum. So if a child or a family member is dealing with symptoms that may suggest that he's on the spectrum, you'd want to speak to your family doctor, get a hafnaya, get a referral to Hitpatchut Hayeled, and start the process at a young age. Okay, the kupot, once the child is recognized as being on the spectrum, there's a basket of services provided. Mishrad HaBriut has identified which services they provide. There's a specific amount of hours each child is eligible for. And these services are either given through the Kupa or here too, the Kupa subcontracts with other service providers as well. Okay, but you would find out from your Kupa where you could get the services needed for a child on the spectrum. Okay, and indeed, in addition, it's important to note that children on the spectrum, or in general, children with more, and adults, we'll get to that later, with mental health illnesses are eligible for Bituach Leumi disability benefits, which can be helpful for the family to pay for additional therapies if needed. And that would be something that the social worker at your Kupat Cholim can help you take care of. Okay. I'd like to talk briefly about therapy related to the security situation, war. So there is something called Merkazei Chosen. These are resilience centers. They're located pretty much throughout Israel, okay? And they provide free therapy for people who are affected by the war or by terrorism, missiles, sirens, etc. Originally, it was specifically for people who themselves were directly in a pigua, in a terror attack or affected by the war. At this point, they're pretty generous. The umbrella is pretty large, and if they'll pretty much give to anyone who feels that they were traumatized or affected by the war. They'll give 12 sessions at a time, and they're usually able to offer up to 36 sessions. Okay, there's a list of these resilience centers, Merkazei Chosen, could be found online. This is funded by Mishrad HaBriut and Bituach Leumi. Okay, it's 36 sessions. It says here 35. It's 36. Okay. Let me here. Okay, now I'm going to talk about mental health services for people who are dealing with more acute or severe mental health issues. I'm going to talk about inpatient services. Okay, there are a bunch of psychiatric hospitals and psychiatric wards in general hospitals throughout the country. Okay, they serve people dealing with severe and acute mental health cases. I'll start talking about voluntary admission. Okay, that's the most common route. When a person is suffering from different mental health symptoms and they recognize that they have a need for hospitalization, and the person agrees to go to the hospital. Okay, so the best way to do it would be for the individual to be referred by his physician, by the psychiatrist or family doctor. Okay, who would give him a letter, and you would take that to the hospital. Okay, and at the hospital they have almost like the psychiatric hospitals have like an ER for the psychiatric patients. They'll conduct an evaluation and see if hospitalization is necessary or not. If it's recommended, the client would sign a consent form and could be admitted to the hospital. When it's voluntary, one could leave at any time they want, unless, of course, the condition deteriorates and requires involuntary treatment. Now, at the psychiatric hospitals, there'll be a list in a bit of the hospitals. They all have emergency rooms you could go to. They're open 24/7, year-round. You don't need any, it's best to have a hafnaya, like a letter of recommendation from your doctor, but you don't need one. So if for whatever reason someone isn't in treatment and feels that they're really not doing well emotionally and need to see a psychiatrist, they could go to the emergency room, okay? The idea there being to stabilize and prevent deterioration. At the emergency room, they'll assess the need for treatments, whether it be hospitalization or for a referral to see a psychiatrist in the community. As far as cost goes, emergency room at a psychiatric hospital is free of charge, okay? So you don't have to come in with a hafnaya, with a referral, nor would you have to pay. So even if you go and do not need hospitalization, you'll be seen and you'll be able to either be hospitalized or go home without having to pay. It is important to note that here too, like all the hospitals, there's usually going to be a long, there'll be a line there. So you have to take into account that you'll be waiting there for a while. As far as a general hospital, right? So each hospital in the country, right? The big hospitals, Hadassah, Tel HaShomer, Shari Tzedek, etc. They have psychiatrists on call, okay, on their staff. And if a person comes to the general emergency room with psychiatric symptoms, they'll call in the psychiatrist, and he will examine the patient and will recommend if this person needs treatment, whether in that general hospital, if they have a psychiatric ward. Okay, some of the bigger hospitals have psychiatric wards in the hospital, and some, if they don't have, they will refer to specific psychiatric hospital. Okay. Now, when one goes to the emergency room in Israel, this is true both for mental health, but for physical health as well. You have to have what's called a Tofes 17, Form 17, which is pretty much that the Kupa will be paying the hospital for the treatment. Okay. Now, when a person is hospitalized, the law is that they're exempt from paying this fee. Okay. However, if they're not hospitalized, you just go to the ER or seen and sent home, then there is a fee that one has to pay in the general hospital at the ER, okay, if one isn't hospitalized. Let me move on here. Okay, as far as voluntary admission, can one choose the hospital that they want to go to? So it depends on, bed availability. Are there available hospital beds, psychiatric beds? Usually the hospitals are at full capacity. It depends also on the urgency of the condition, okay? So if the situation is urgent, then one would be hospitalized in the closest hospital. There's some of the hospitals that are affiliated or work with specific kupot, while there are other hospitals that accept patients from all the different kupot cholim. Some of the hospitals have specific deal with specific populations, okay, forensic, children, autism, geriatric, etc. Okay, so if there's a specific population or specific need, one might be referred to one of those hospitals. Okay, and the system, the mental health system, usually, if hospitalization is necessary, will usually prefer to hospitalize one within the region that they live in. Okay, as opposed to sending someone to a hospital in another part of the country. Okay. And now, as far as increasing, if you were told by someone, recommended to go to a specific hospital, in order to make that more likely to happen, number one, you would want your psychiatrist to write a letter and recommend that in the letter. Okay, his authority and recommendation would be taken into account. It's important to state that at the time of the psychiatric evaluation at the ER at an early stage to make that clear to the doctor and to the staff seeing you. And it's always helpful to have a family member advocating on your behalf. Okay. Okay. I'm going to move on. Now, as far as involuntary admission, okay, so the law here is that this is a person could be hospitalized involuntary if he falls under the following criteria. Okay, this is based on the mental health treatment law, which is relevant when a person has a psychiatric illness and primarily is in danger to themselves or to others and refuses to receive treatments. So there has to be these three criteria have to be met, all three of them. Okay, a psychiatric illness, danger to themselves or other, and refuses to receive treatment. This is just a list of the hospitals. This will all be available for you to see later, so you don't have to write this all down. There are a few hospitals up north and in the Haifa region. Then in Yerushalayim, we have the hospitals of Kfar Shaul, Etanim, Herzog, and then there's also mental health clinics. Many of these hospitals have outpatient clinics as well. We have in Beersheba, in Soroka, in Ashkelon, Barzilai, and there's a few other hospitals, smaller ones as well. Now, another option instead of hospitalization is what we call balancing homes, or in Hebrew, a bait mazen. These are relatively new in Israel. I'd say the last 5 or so years they've been around. These are short-term, high-intensity therapeutic residencies that are meant to help people who otherwise would have been hospitalized, but their condition is such that they're able to manage with intensive care, but in the community. Okay, so this would be like a house, okay, usually in a quieter neighborhood in the city. Most of these balancing homes can accommodate 10 to 12 residents at a time. Okay, the rooms are separated, of course, by gender. There's some homes that are only for men or for women. These homes have a psychiatrist and a social worker, psychologist, and peer support as well. Okay, so this is for people who aren't in danger to themselves or others, need a little less intensive care, and would prefer to avoid being hospitalized in actual hospital. So they have these balancing homes. At this point, there are many of them throughout the country. There's some of them that provide unique care for specific populations. There's some for soldiers who are dealing with post PTSD. I think there's 1 or 2 specifically for people who are survivors of sexual abuse. And there are a few other specific balancing homes for specific populations. These are funded by the Kupot Cholim. Now, usually each kupa will work with 2 or 3 specific balancing homes. Okay, so you would have to find out through your kupa. To get into one of these homes, though, one has to be referred through the kupa. Okay, so you can't go directly unless you want to pay out of pocket. But if you want it to be covered by the kupa, you would have to be referred by a psychiatrist or someone in the kupa. Okay. Now, also a newer development is psychiatric home hospitalization, okay, which has also been started since COVID pretty much, which is also an alternative to hospitalization. This allows also for people who have more intensive mental health crisis to receive care from a multidisciplinary team. So this here too will include a psychiatrist, usually a nurse, social worker, and maybe a psychologist who will conduct home visits at a pretty frequent rate. They'll come to you. Some of it is done online. Some of it will be Zoom meetings. They will come and do the blood work, etc., if that's needed. Okay. The plus to this is that the treatment is given in a familiar and supportive environment, right in a person's home, which can lead to more positive feelings, more calmness, more feelings of control and self-identity as opposed to being in a hospital. And it's less of a, I guess, tear away from your community. Okay. Here too, a person would have to be referred, okay, by the psychiatrist in the kupa. And these services are often offered by a company that is subtracted with the kupa. Okay, so usually it won't be the kupa doctor themselves, but an organization that is paid by the kupa, and they'll send their staff to do these home visits. Okay, so this is psychiatric home hospitalization. I'm going to move on here. Another type of care is psychiatric day treatment, what we call in Hebrew ishbuz yom. Okay, so this is comprehensive therapy for people who are in an acute state, and this is designed to prevent hospitalization. So this usually is provided to patients who are either on a stage where they don't need to be in a hospital, but are kind of close to that, or for patients who are in inpatient treatments and now are doing well enough that they don't need to stay in inpatient, but they still need intensive treatment. These programs are usually 3 to 5 days a week. Okay, it's kind of a 9 to 3, 9 in the morning, 3 in the afternoon. These are, there's no charge for these services because they're covered by the kupa. But here too, you need to be referred by the kupa cholim, and there often is a wait list at these places. Okay, there are specific here too, specific day treatment centers for specific populations for eating disorders, PTSD, postpartum depression, etc. Now, I'd like to talk a little bit about the benefits that one might be entitled to if they're dealing with mental health condition. Okay, so if a person has severe or chronic mental health condition, one might be eligible for disability. In order to claim the disability, you would go on to the Bituach Leumi website, or you can go to a Bituach Leumi office, and you would fill out the application for Gimlat Nechut. You would attach, it's a pretty simple form, pretty much filling out your name, bank details, Tudat Zehut, and you'd attach any medical documentation. In addition to they ask for a few financial documents, particularly about your work history. Okay. And then these papers would reach the Bituach Leumi branch, would be examined first by a claims officer and then by a doctor. And if everything seems right, the person would be called in for a medical board, in this case with a psychiatrist who would determine if there's medical disability, and if so, to what degree. Okay. Now these boards are pretty much, they want to examine the impact of the illness on one's ability to work and to function in the community. Okay, to be eligible for this, you have to be an Israeli resident between the age of 18 and retirement age, and the illness has to have an impact on your ability to be employed. Okay. So I'm not going to get to the exact details, the numbers, you could all see this here. But there has to be, in order to be eligible for this, there has to be a significant effect on your ability to work for extended period of time. Okay, so it wouldn't just be someone who was depressed for 2 weeks, but it would have to be for a number of months that it really affected their ability to work. Okay. Now, if one is recognized as having medical disability, okay, usually it will be 60%, but at least 40% disability. Okay. And also they have an incapacity to work, okay, which there's different degrees of that as well, anywhere from 50% to 100%. So if one meets those two conditions, there's both medical disability and there's incapacity to work. Okay, those are both determined by Bituach Leumi. Then one would be eligible for disability benefits for a mental health condition. So other than getting the disability money from the Bituach Leumi, it opens up eligibility for Sal Shikum, rehabilitation services. Okay. Now, the services, rehabilitation services, it's a basket of services, okay, that a person with disability, so we're talking about people with more chronic or severe mental health challenges. These services include housing, employment, education, social support, and these here too, so people 18 years or older who are already recognized by Bituach Leumi as having a disability. These services also include guidance for family members of the person who's dealing with a mental health disability. And these services are pretty comprehensive. The process of applying for this, so if you were approved Bituach Leumi, then stage 2 would be applying for this basket of rehabilitation services. The easiest way to do it, because this process is a little complex, all the forms involved, would be to meet with a social worker at your Kupat Cholim who would help you through the process, because it's a lot of different forms and papers, and it's just better to have someone help you with it. What does happen, so you fill out the forms, it's done online with the social worker, and then you would be invited to a committee. Okay, this is done by Misrad HaBriut. Okay, so the social worker at your kupa would help you fill out these forms. These forms are sent to Misrad HaBriut, to the Ministry of Health, and then they have a committee, the Ministry of Health. The committee usually includes a psychiatrist, social worker, times an occupational therapist. And at this committee, they'll determine if you're eligible for these rehabilitative services, and if so, which services you're eligible for and could benefit from. Okay, so this includes assisted, workplaces that are catering to people with disabilities, group homes, these supported like group apartments, workplaces, social clubs, and dental care is also offered. Okay, so and a person here, Misrad HaBriut, works with a number of organizations, a number of NGOs, Amutot, and you can choose which one you want to receive the services from. So if you're approved on this supported housing, you could choose between 10 different organizations that offer this service, okay, of living in a home where there's a social worker and the care worker who come visit and help you deal with daily living issues. Okay, so you can choose, once you're approved by Misrad HaBriut, from the list of service providers that they work with. Briefly, just as far as some numbers, there's about 115 or 120,000 people with a mental health disability in the country. Of those, only about 30 to 35% are receiving this rehabilitative basket. Okay, so the utilization rate is low. This is for a number of reasons. A, because these services only began 20 some years ago, and the system hasn't been able to keep up with the need. So there aren't enough services yet out there to be able to provide for all the people who need it. And there's also many people who would be eligible for these services but don't know of their existence, or people who have a hard time going through the long bureaucratic process. And there's also a shortage as far as these committees. So a person has to be pretty committed to and focused on getting these services. And it's just best to have a social worker recommended at the Kupat Cholim to help you through this process in order to actually get it. Okay, once you're in the system, generally you could be there for as long as needed. So it's from 18 to retirement age. There are many people who've been benefiting from these services for over 20 years at this point. and it kind of gets renewed automatically every year or as needed. Okay, briefly about addiction treatment. There'll be time for questions pretty soon. So addiction treatment is, there's different types of treatment for people with addictions. The actual, let's say, detox for people who are, dealing with drug addiction or alcohol, that is often provided through the Ministry of Health. While the long-term care, the rehabilitative services for people dealing with an addiction, such as, kind of like a community group center or meetings, that's offered through the social services, the Lishkat HaRevacha, okay? And they have a network of clinics and rehab centers for people dealing with addiction. So if you have a family member who is dealing with an addiction, if you want to receive help through the system, that you would contact the local social service, the local Lishkat Revacha. A social worker there would meet you and would conduct an intake assessment and then direct you to the appropriate treatment for yourself or for your family member. These are some mental health hotlines. Okay, so this slideshow will be available for you afterwards. You don't have to write them down now, but each of the 4 Kupot Cholim have a unique, have a specific phone number for mental health. Okay, then another hotline is Iran, which is 1201. That's kind of like the emergency mental health hotline, which is man 24/7. So anyone who is dealing with say suicidal thoughts and need to speak to someone could call that number. There's an organization called Natal, which is they specifically provide guidance and help for people who are dealing with war-related trauma and PTSD, okay, which unfortunately is very prevalent these days. Another great resource is Amudim, okay, and I'll talk about them shortly. And the National Resilience Center, right, the Merkazei Chosen we talked about beforehand. This is their hotline, and they have a specific English number. Briefly about Amudim, it's a free mental health crisis case management service. Okay, you could call them. This is all free of charge. You would contact Amudim, either call them, and this is their website. A team of professional case managers who will speak to you on the phone, take the relevant history and details of the issue that you're dealing with. They'll assign you a case manager. This is all without charge. And they will help guide you to the actual service that would be best for you, whether it be in the public system or if it would be private, they would recommend, credentialed therapists that they know. They'll make a plan of services for you, and they'll also follow up and be in touch with you as needed. Okay, so this is definitely a good resource to have on Amudim Israel, free of charge, and they'll direct you through this process because it was a lot of information. And when it comes to Lamaisa, they should be able to direct you based on your individual needs. Briefly about the clinic that I am the director of, Jerusalem Therapy Center. So it's co-founded, as I said earlier, by Wurzweiler School of Social Work and Amudim. And we provide therapy for the Anglo population in Jerusalem and the surrounding area. It's at a very subsidized rate, anywhere from 150 to 50 shekel per session. Okay, very professional clinic and standards. And this is a good resource to have for people in Jerusalem who need English-speaking therapy, and usually we're able to provide the therapy in a short period of time without the long wait that one would experience in the Kupa. And this is also both professional and in English. Okay. Last 2 things, and then I'm going to open up time for questions, is regarding domestic violence. So there's a national domestic violence hotline, and Dr. Monk maybe will answer questions about domestic violence if you have shortly. The number is 118. If the service is open 24/7, there'll be English speakers. The services for domestic violence are provided through the municipality, the social services, and they work with specific organizations that specialize in this area, such as Naamat or WITSO. Okay. So I think I've reached the end of the end of the presentation, and we could open up, Tippy, the microphone if anyone has questions or if people asked in the chat. I wasn't able to follow while I spoke.
Okay, so I'm inviting people to write questions in now. I want to add, if I can, one very quick thing here. When you had the
Please.
list of the phone numbers, so
I may have omitted any, so please feel free to add.
no, well, so the yeah, you didn't admit it, you didn't omit, but the Iran Emotional Crisis Hotline actually has its own phone number for English-speaking Olim, and that is *3201. So we'll make sure that that is in the follow-up email, and you can try that number directly as opposed to their general crisis hotline phone number. Okay? I'm not seeing any questions. If anybody has, please, you can welcome to write them in. And maybe I could see if Dr. Monk, did you have anything you wanted to add?
I just wanted to say that the system is very different between the United States and North America and Israel. I think the transition between America and Israel, making Aliyah, having the changes is something that can evoke a lot of anxiety. It can create a lot of tension, and just to know that that's normal, and especially during the times that we're living in right now, with the war, tension is high, and it can have its effect on your mental health. And not if that's how you're feeling, then reach out. That's why the organizations are there for you, to reach out and to get the help that you need, so that really you can your transition can be as best as possible. Sippy, you're
Thank you.
muted.
Yeah, I just saw that. Thank you very, very much. Okay, I appreciate that. I always like to tell Olim, Aliyah is a great, amazing experience. Immigrating to a new country is very, very difficult, and it can be very unsettling, unbalancing, and especially the situation that we're in now. There is a question, Yair, and I can answer it, you can answer it. For going to an emergency room, the presentation stated that we need Form 17. How can we get that in an emergency situation? Do you want to
Please
respond?
answer, Tippy. Why don't you go ahead?
Okay, so this is true, by the way, in any emergency situation, not just a mental health emergency situation. And it is, again, different than what you're used to in North America. You do not go to emergency room without some type of referral. The easiest, well, one way to get that referral is you're at your doctor and the doctor says, she or he says, you need to go to the emergency room. They'll give you the referral. Another option is to call during or stop by the clinic during the working hours. That is obviously, if it's an emergency that's less emergency than like a heart attack, God forbid, okay? You can also call one of the main numbers of each of the 4 Kupot Cholim, speak to a nurse online or a doctor online, and they will assess whether you should or should not be going to the emergency room. And if they do think you should be going to the emergency room, they will also send you that or put that form in your file, and they'll see it at the emergency room. What needs to be clear, or another doctor that can write that same referral. Okay, what needs to be clear is, and I want to specify this not just for mental health crisis, but in any crisis, really. Somebody's feeling chest pains, or if you have a broken limb, or pregnant women. There's certain situations where you do not need this Tophus Shvasrei, this set Form 17. As Yair said, if you're hospitalized, you don't need it, but also certain situations that are obviously, you don't want to waste time if you're feeling chest pains and you think it might be a heart attack, okay? The same thing if somebody's in a mental health crisis, God forbid, feeling suicidal or whatever, they should go directly to the emergency room. And then, if a worst case scenario is you're not hospitalized and you are charged, you can turn to us. We have helped Olim appeal and get part of it paid back, all of it paid back. But that is the way to get the Tophus Strasser, to get the Form 17, is the easiest way is to call the doctor or the nurse online on call at your Kupat Cholim, whether it's Kalit, Muchedet, Maccabi, or Leumit. Yair, did you want to add to that?
Thank you. No, that was perfect. I would just add that at the psychiatric hospitals, you do not need a Toferschweizer. Right? So that's only
Thank you.
going to the general hospital and want to, be in the psychiatric ward there. But if you would go to a psychiatric hospital, you do not need the Toferschweizer.
Thank you.
Yeah.
Okay, I'm going to read another question. How can I get connected to a vocational rehab counselor?
Yeah. So that is part of what's called Sal Shikum, the rehabilitative basket. In order to get that, you first need to have Bituach Leumi disability. Okay, you'd have to be recognized as having a mental health disability, and then you would be eligible to begin the process of receiving this basket of rehabilitative services. So it really depends on what stage you are in the process, but if you already have Bituach Leumi, and if you're already approved Sal Shikum, then there would be usually a point of contact, a case manager, or the person who helped you get that, the rehabilitative basket, and they'll refer you to the agencies that provide the vocational counseling. If you don't have if you're not recognized yet through Sal Shikum, the first step would be to go to the social worker at your kupa and ask to apply for Sal Shikum, and that would include the vocational services.
Thank you. Here's a question. Can utilizing any of these mental health services affect other areas of life? For example, can an employee consider an applicant's mental health history? Important question.
Yeah, that's a good question. So number one, they generally speaking wouldn't know, right? It's they wouldn't have your medical file in any way. If you're receiving disability, so for a more minor mental health challenge, they would not know. If you're receiving disability benefits, then you get certain tax cuts because of the disability, and that there's something called Tofes 101, which you fill out every year, which is your about your taxes. Um, so if you want to get the tax benefits and you circle that you have a disability, but they wouldn't know what type of disability. Okay. But otherwise, as far as employment, it really should not affect that. Other areas might be one who has a firearm. So potentially, if you're receiving psychiatric services, you will need to get a letter. It doesn't automatically make that not possible for you to have a firearm, but you need a letter from your psychiatrist saying that it's safe for you to carry a firearm. Those are the two areas that I could think of, or driver's license. Also, if you have a more severe mental health disorder, which affects your ability to drive safely, the Ministry of Health, they have a specific a center where they evaluate. This is not just for mental health, it's for different types of health conditions, your ability to drive safely. So that would be evaluated, but it wouldn't automatically negate your ability to drive.
I'll add
Yeah,
that
sorry.
apart from all the conditions that Yair just mentioned, and I'm just going to say, Yair, thank you so much for this presentation. It's incredible.
My pleasure.
Your mental health is confidential. So anything that goes on should be and stay confidential, apart from those specific stipulations that Yair just mentioned.
Right.
Just mentioned if you are of Army age, it could affect your Army situation.
That's true as well. It could. There too, though, if you're being treated by by psychiatrists, by therapists who believes that you're fit to serve, they'll often help you through the process. I mean, each case is different, but if it is safe and the psychiatrist is willing to to help you through that, you often will still be able to serve meaningful service. I will also state, as far as the Kupat Cholim, if you're receiving mental health services through the Kupa, it won't have the content of the sessions is not cannot be seen by your primary physician. It will only just say that you had a meeting, with a therapist, and the date and private, psychotherapy. Okay, it will say, of course, medications, because the doctor needs to know as far as how different medications interact. But otherwise, your mental health, the file itself will not be seen by your occupational therapist, your physical therapist, or or your dentist or anyone else like that. So it is confidential, even within the Kupa. It's specific file just for the mental health team. Okay.
There's
Very good.
another question about continuation of care. If somebody's on medication, was on medication in the US, how they can get prescribed that medication here in Israel.
Okay, so I'll try to answer, and maybe the Nefesh B'Nefesh team might also want to add to this. But um, as far as receiving psychiatric medication in Israel, at this point, most of the kupot, to my knowledge, you can get medication through your primary physician. For most of the medications, there may be very specific medications which need to be approved by the kupa, either because they're not a first-line treatment or they're more expensive. But generally speaking, your family doctor will be able to provide you with most psychiatric medication. They may ask you to see a psychiatrist the first time or every couple of years, but most often, definitely someone who's taking, continuous treatment. Usually it's just provided through the Kupa. But Tzipi, I don't know if you want to add as far as Nefesh.
Yeah, no, that is
Sure.
correct, but I would say that just like other medications too, at some point, the primary care physician is going to refer you to the specialist, such as a psychiatrist or your cardiologist or whatever it may be, for them to reevaluate, go over your history and make sure that it's up to date and so on. I hopefully everybody who is listening to this before they made Aliyah, and if they're taking certain medications, whether they're psychiatric medications or otherwise, hopefully you checked ahead of time to make sure that they do exist in Israel, and if they don't, what would be a good substitute? If there's anybody who's has a problem like that, you certainly should be in touch with us at Nefesh, okay? There's just really two more questions, so we're gonna take them even though we're past the hour.
Okay.
So everybody,
Sure.
again, thank you for everybody's, it was an amazing presentation, and let's just get through the other two questions. One is, you mentioned ASD process for children to get services, but not for adults. In general, someone is high functioning, does not get services because they can work. Is that correct?
Well, the thing is that I think past 18, I, I could be wrong on this, so this has to be double checked. But to my knowledge, past 18, you would not be, the Kupa doesn't have to provide the evaluation for you, okay, of ASD. So if you don't have an existing evaluation, the whole process of it has to be a specific psychologist and psychiatrist who are knowledgeable in this field, and it could cost 7 or 10,000 shekel, that process. So if you have a family member, it's still probably kedai to do, because then the person would receive disability benefits and the right treatment. Okay. But unfortunately, for adults, it is expensive to do that process, and it's recommended to do when one is younger.
Okay, thank you. And the last question I'm seeing here, and if people have more questions, you're welcome to send them to us in an email. If we can respond, we will. Now we'll refer them to the proper person. Somebody writes here, I went to, I guess it says Amudim instead of my Kupa for referral. Will that be a problem or slow down the process?
Right. So it's not a problem. Okay. They're independent in the sense that the Kupa depends if you want to see someone in the Kupa. So you contact the Kupa, and then you're pretty much put on their wait list for an intake and for therapy in the Kupa. Okay. While Amudim, they have a broader range of referrals that are also outside of the Kupa. So it shouldn't be a problem to contact both and to see where you can get the right services for you and in the most efficient manner.
Okay, so we're gonna end this. I'm gonna thank you very, very much. I really appreciate, we all appreciate your time, Yair, your time, Dr. Punk. Really, really, this presentation was fantastic, very comprehensive. An email will be sent out in the next 1 to 3 days with a link to this, and to the slideshow presentation will be sent as a PDF with all the information, and everybody should have calm, happy days, and thank you very much,
Thank you very
Yair
much.
Berko. Thank you very much,
Thank
Dr.
you.
Monk.
Thank
You're
you to
welcome.
Nefesh B'Nefesh, Tzipi, and everyone, and a pleasure to see you all. Okay.
Thank you all.
Have a good evening, everyone.
Good night, everyone.
Thank you.